Hi, I'm Dr. Ramasubramanian. I'm a consultant in infectious diseases at Apollo Hospitals, Chennai, and I'm also the medical director of the Capstone Multi-Speciality Clinic in Chennai. My topic for today is adult immunization. People are very familiar with the concept of pediatric immunization. It has been around for several decades, where we vaccinate kids to improve their immunity against certain vaccine-preventable diseases. It has been shown that vaccines are quintessential in prevention and has saved many lives. There are certain conditions where even if it doesn't prevent the infection, vaccines can make the infections milder, less severe, so that morbidity is minimized. But the concept of adult vaccinations is something not very familiar in India, and my topic today will cover the aspects of adult immunization. The first question is, why do adults need vaccination? If we have already had our vaccines in childhood, is there any benefit in having vaccines when you're older? There are several reasons, which may include that as you grow older, your immunity given by vaccines in childhood may wane. So you need booster shots. There are some infections, especially viral infections like influenza, where the virus keeps changing with time. So every year, there is a new strain of influenza virus circulating, which may cause infection, and you need annual influenza shots to protect yourself. It may be that as you grow older, you develop certain comorbidities, diabetes, high blood pressure, heart disease, lung disease. So you may become more prone to certain infections, which may require vaccination to prevent the severity of the infection. It is also possible that certain vaccines have to be given based on your lifestyle. People who are traveling to certain parts of the world where there are certain infections may require vaccines to prevent these infections, typically yellow fever. And most importantly, you may need to cocoon or protect certain kinds of individuals. For example, children under 6 months of age cannot be vaccinated because the vaccines have not yet proven to be safe for them. So to prevent a young child from getting flu, all the members living in the household need vaccination against the flu so that you can cocoon or protect the child. This is the same with elderly people whose immune response also may be weak. The Advisory Committee on Immunization Practices is an expert team in the United States which gives recommendation on what vaccines adults need. This is also endorsed by the CDC. And the table shown very clearly gives advice on vaccinations based on the age of the patient and probably the underlying comorbidities also. We shall now look at the vaccines which an adult may need. The first is the influenza or the flu vaccine. Flu, as you all know, is universal, and in tropical countries, the infection is not seasonal. It can occur all through the year. The flu vaccine is recommended annually for everybody based on whether you live in the northern hemisphere or the southern hemisphere. And it has been shown that the vaccine not only minimizes the severity of the flu and up to 70% protects the individual, but it also has benefits which extend beyond the flu. It also prevents cardiovascular and cerebrovascular diseases and mortality related to myocardial infarctions. Is it safe? Suffice to say that taking the flu vaccine is any day safer than getting the flu. India also has a heavy burden of pneumococcal infections. In fact, invasive pneumococcal disease can occur in relation to certain comorbidities. It has been shown that there is a 3-time increased risk of invasive pneumococcal disease in diabetics, almost 6 times higher chances of IPD in patients with chronic heart and lung disease, 11 times an increased risk in alcoholics, and almost 50 times an increased risk in solid cancer, hematological cancer, and patients with HIV and AIDS. So these are the risk groups who need vaccination against pneumococcal disease. And the recommendations are clear in the next table. All adults between the ages of 19 and 64 with underlying chronic conditions like diabetes, heart disease, lung disease, liver disease, alcoholism, or smoking need the polysaccharide pneumococcal vaccine. If a person is over 65 years of age, what is recommended is a conjugate 13-valent pneumococcal vaccine followed 1 year later by the polysaccharide vaccine. All adults between the ages of 19 and 64 who may have immunocompromising conditions like cancers, renal failure, or who are on immunosuppressive therapy need a conjugate vaccine, 13-valent vaccine, followed 8 weeks later by the polysaccharide 23-valent vaccine. The polysaccharide vaccine has to be re-inoculated after 5 years. For all adults with cerebrospinal fluid leaks or cochlear implants, a conjugate vaccine followed 8 weeks later by the polysaccharide vaccine is recommended. This will help prevent invasive pneumococcal disease, which has a high mortality. Cervical cancer, if you look at the statistics, show that more than 200 women die every day because of cervical cancer in India. Almost 8 women die every hour, and this equates to almost a death of a woman every 7 minutes. So all women, before they reach puberty or become sexually active, need to get a course of cervical cancer vaccine. This will help prevent metaplasia because of human papillomavirus infection, which may progress to cervical cancer. The other vaccines which adults may benefit from include the typhoid vaccine. We currently have a conjugate vaccine which has immune benefits for over 12 years and even maybe for a lifetime. We have the tetanus, diphtheria, and pertussis vaccine. After the childhood course of immunization, a tetanus and a diphtheria booster has to be given every 10 years. Out of this, at least 1 dose should be a tetanus, diphtheria, and pertussis vaccine. Measles, mumps, and rubella vaccine also is mandated for everyone. If a person has received 2 doses of MMR after the first year of age, that is believed to give lifelong immunity. Meningococcus is also advised if there is an increased risk. Typically, it is seen in certain parts of the world, sub-Saharan Africa, maybe in parts of Saudi Arabia, and also in various countries where there is congregation among adolescents, especially college-going children staying in dormitories, prisons, and other situations like army men where they congregate may increase the risk of meningococcal infection, which can be prevented by a vaccine. Shingles or herpes zoster is also preventable. It has significant morbidities, which can also increase the risk of vascular events in the brain. And to prevent this, the shingles or the zoster vaccine is advisable for all adults over the age of 60 years. There have been recent changes in the recommendations against rabies. The post-exposure prophylaxis for rabies initially had 6 doses, which came down to 5. The recent CDC recommendations are 4 doses of vaccines to be given on day 0, day 3, day 7, and the 4th one between 14 and 21 days. In those people who have had vaccines for rabies earlier as a pre-exposure prophylaxis, 2 doses post-exposure on day 0 and day 3 would suffice. This is very essential, and please remember that whenever you suspect an animal bite caused by a rabid animal, you also need to give immunoglobulin or monoclonal antibodies at the site of bite and then follow it up with the vaccines. Japanese encephalitis virus is also endemic in several parts of Asia, including India, and any traveler in India who stays for more than 1 month or who is likely to be exposed to rice fields, pig farming, situations which may increase the risk of Japanese encephalitis needs to be vaccinated. In fact, a Japanese encephalitis vaccine is currently available commercially in India, and certain parts of Tamil Nadu and Uttar Pradesh, children are strongly recommended to be vaccinated. Yellow fever vaccine is the only mandatory vaccine for travel to certain parts of sub-Saharan Africa and parts of South America where yellow fever is endemic. This is legally mandated, and earlier, every 10 years a vaccine was recommended, but current recommendations only suggest that 1 dose would be enough to cover your lifetime. So based on the age and underlying risk factors, we can recommend the following. For college students, if they have not had measles, mumps, rubella vaccine or the meningococcal vaccine, it is recommended, especially if they are going to stay in hostel accommodation. For all adults between the ages of 19 to 50, annual flu vaccine, a tetanus, diphtheria, pertussis, at least once in 10 years, and the human papilloma virus or the cervical cancer vaccine is recommended. For adults over the age of 50, apart from flu and tetanus, diphtheria shots, a shingles vaccine would also help, especially if they are diabetics. For elderly over the age of 65, annual flu shots, tetanus, diphtheria, pertussis, a shingles shot, and definitely the conjugate pneumococcal vaccine followed 1 year later by the polysaccharide vaccine. And for all adults over the age of 19 years with comorbidities, flu, Tdap, and a polysaccharide pneumococcal vaccine is recommended. For pregnant women, certain vaccines are recommended in the 3rd trimester, especially the tetanus, diphtheria, and pertussis vaccine, and also the flu vaccine if there is a possibility of flu cases going around at that time. These would safeguard not only the mother, but also the child. Healthcare workers are also strongly advised to take certain vaccines. These may include hepatitis B vaccine, I hope all of you have had it, annual flu shots, MMR vaccine, chickenpox vaccine in those who have not had the disease before, tetanus, diphtheria, pertussis boosters every 10 years, and also meningococcal vaccine for microbiologists who handle meningococcal bacteria in the lab. But if you look at the state of adult immunization, it is unfortunately has a very poor uptake, especially in India. And if you look at who influences most the patient's decision to take the vaccines, it happens to be his primary care provider or the doctor whom he visits, maybe a cardiologist, maybe a nephrologist, maybe a gastroenterologist. And unless we doctors are aware of the importance of vaccines and what benefits they offer, the patient is going to lose out on staying healthy. So please remember, adult vaccines have to be made more attractive. People have to ask for them. And also remember finally that vaccines do not save lives. Vaccination does.